Okay, so today we are going to be doing an assessment on your eyes, Joshua. So to start, I would check your visual acuity by checking your distant vision with the Snellen chart, and for near vision, I can use either a newspaper 14 inches from your nose or the Rosenbaum test. Okay, so I'm going to begin by checking your eyebrows. So they extend from the the inner canthus to the outer canthus, and they are both equal and full. Then I would check your eyelashes on the upper and lower lids, and they both extend upwards. And now I'll be checking your sclera on both sides, and it's nice and white and intact. Then I would check the lacrimal apparatus, and there is no swelling or edema on either side. Now I'm going to check the lacrimal duct, which is in the inner corner of your eye. And to do so, I would put on a glove and I would press on the inner corner right here to check for regurgitation, and I don't see any, which is good. Okay, thank you. Okay, so now I'm going to examine your eyes. So I'm going to shine this light right across, and I can see that there are no apparent abrasions. Okay, so now I'm going to have you look straight ahead, and I'm going to shine this light equally so we can see it shines symmetrically on both sides, okay? And I can see that your pupils are round and your irises are the same color throughout. Um, they are brown on both sides and they're consistent. Okay, so your pupils are round and responsive to light bilaterally. So now if you could look across the room for me. Okay, now look back. Okay, and now follow my fingers for me. Okay, so when you looked across the room, your pupils dilated, and then when you follow my finger, they constricted. Okay, so your pupils are round, symmetrical, and responsive to light. So I'm going to have you look across the room for me. Okay, now follow my finger. Okay, so when you looked across the room, your pupils dilated, and then when you followed my finger, your pupils converged and constricted, so that means accommodation is intact. Okay, so I'm going to do a couple tests to your eyes. So this first one I'm not going to do to you because it is a little invasive, but basically what I would do is I would take a cotton tip applicator and touch it right to your cornea. That way both of your eyes would blink at the same time, causing a bilateral blink response. Okay, so the next thing we are going to do is check your eye muscle balance. So I'm going to have you follow my finger, and I'm going to make a big H. So follow it with your eyes and not your head, okay? I'm going to start up here laterally and come down. If you have good parallel tracking. And if I hold my finger out in the far lateral view, this is where I could check for any nystagmus. Okay, and I'll come down. Okay, so your extraocular movements are intact, and I don't see any signs of nystagmus. Okay, so now we're going to check your peripheral vision. So I'm going to have you take your note card. We're going to stand about 3 to 4 feet away from each other. So if you could just cover your eye and I'll cover mine. Okay, so let me know when you see my fingers. Okay, superiorly. Okay, nasally. Okay, up. And then across. Okay. And then we would do the same for the other side. So your peripheral vision is intact. So thank you. Okay, so now I'm going to take a look at your ears, and I note that they're both symmetrical. And if I were to draw a line from your outer canthus to the top of the auricle, it would be a straight line that would fall right about there, so that's good. And then your ears should be between 4 and 10 centimeters, which both of them are. Okay, so now I'm just going to palpate right here and pull back. Is that tender at all? No? Okay, good. Now I'm going to just palpate and feel right over your mastoid process. How is that? Is that tender or painful at all?
No.
Good. And when it wasn't painful up here, that means there's no tenderness in the inner canal, so that's good. Okay, so now I'm going to take a look inside your ears. So I just have a speculum on the otoscope, so I'm going to just insert it in about a centimeter or so, so please let me know if there's any tenderness. Okay, so I can see small, fine villus, a small amount of cerumen. I can visualize the tympanic membrane. It is pearly gray in a cone of light. and I can see the bony prominences. Is there any tenderness at all there? Okay, thank you. Okay, so now we're going to do a couple of tests. So I'm going to start with the whisper test. So I'm going to ask you to occlude this ear for me, and I'm going to stand approximately about 2 feet away. I'm going to whisper 3 words, so tell me what I said. Dog, cat, mouse.
Dog, cat, mouse.
Okay, perfect. You heard that 100%. So now we are going to do a couple tests using a tuning fork. So for this one, I am going to activate the tuning fork and put it on top of your head. Okay, could you hear that more in your left ear, more so than your right ear, or would you say it was about equal? Okay, perfect. So now I'm going to put this on your mastoid bone, so I'm going to activate it, and tell me when you no longer hear it.
Don't hear it anymore.
Okay, so now I'm going to do it one more time just in front of your ear. Okay, so on your bony prominence, it was about 15 seconds, and in front of your ear, it was about 20 seconds for the conduction, so that's good. Okay, so now I'm going to examine your nose, and it's midline. Your nose is the same color as the rest of your skin on your face, so I'm just going to palpate here. Any tenderness at all?
No.
Okay, and I can note that there is no nasal flaring. So now I'm just going to check with a light source. So if I could have you look up for me. Okay, so I see some fine villa hairs. I note that the mucosa is moist and pink. The lower turbine is dark pink. It's nice and dark pink. I don't see any lesions at all. There is some clear drainage, I do note. Is there any tenderness when I look up there at all?
No.
Okay. Okay, so now I'm going to palpate your sinuses. So these right here are your frontal sinuses. Any tenderness here?
No.
Okay. How about here? These are your maxillary sinuses.
No.
No? Okay, good. So now I'm going to transilluminate your sinuses, which are normally done in a dark room. So I'm going to take this light source and shine it right above your frontal sinuses. And sinuses are air-filled, so you should be able to see a nice red glow, which I do. On both sides, I don't see any dimness, so now I'm going to come down to the maxillary sinuses. Can you open your mouth for me a little bit? And you should be able to see right through the palate the light on both sides. Okay, good. Okay, and that shows you that your maxillary sinuses are fine. Okay, so now I'm going to take a look at your mouth, and I can see that your lips are nice and symmetrical. They're pink and moist, and can you go like this for me? Good, and I note that your top teeth slightly override your bottom teeth, which is perfectly fine. They're nice and white, evenly spaced. I'm just going to take a look at your gums. Good, and they're nice and pink. They adhere well to your gum lines. I don't see any retraction at all, so that's good. Okay, so I'm going to look in your mouth with this light, so if you could open up for me. Okay, so your hard palate has transverse root lines on it, so that's good. Can you stick out your tongue? Okay, and I can see that your uvula is midline, that your tongue is midline as well with rough palaver on it. It's nice and pink. And I can note that your soft palate is nice, pink, moist, and glistening. Okay, so I'm going to take a look at your teeth. Okay, so they're nice and white. Open up a little more. And I do see a sign of 2 caries right in the back molars. And your gums are nice and pink as well. Could you take your tongue and actually put it to the roof of your mouth for me? Thank you. So I can see that the tongue moves freely. I don't see any signs of lesions. And I could take a piece of gauze as well and move the tongue side to side to look for lesions. Can you stick out your tongue one more time? Okay, and I can see your tonsils. I could use a tongue depressor if I couldn't visualize them, but I can.